Today, I want to talk about something that affects a significant number of children and that is almost never fully explained to parents. It's called the Atopic Triad. And if your child has eczema or asthma or frequent allergic reactions, this is something you need to understand. Hello, I'm Dr. Sahana, a pediatric dermatologist based in Bangalore. Let me start with the word atopy. So, atopy refers to a genetic tendency to develop hypersensitivity reactions. In simple terms, an immune system that is primed to overreact to things in the environment that most immune systems would simply ignore, like dust, pollen, pet dander, certain foods, and in the case of skin, friction, sweat, heat, and certain fabrics. Atopy is not a disease, it is a tendency, a biological predisposition that expresses itself in different ways in different children. And it most commonly expresses itself in three conditions: eczema, asthma, and allergic rhinitis. These three conditions are not three separate problems. They are one underlying tendency showing up in three different locations: the skin, the lungs, the nose. Let me take them one at a time. Eczema is the most visible. It is a chronic inflammatory condition of the skin driven by a combination of a compromised skin barrier and an overreactive immune system. The skin barrier in an atopic child allows more moisture to escape and more allergens and irritants to enter. This triggers inflammation, which causes the redness, dryness, and the intense itching that parents know so well. Eczema is not an allergy to something specific. It is a condition of how the skin is built and how the immune system responds. This is why treating it requires more than just a cream. It requires an understanding of triggers, barrier support, and immune modulation in some cases. The second condition is asthma. Asthma is inflammation of the airways. The same kind of immune reactivity that shows up on the skin in eczema shows up in the airways as asthma. The airways narrow, breathing becomes difficult, the child coughs, wheezes, and struggles with physical activity. In young children, asthma is often underdiagnosed because the symptoms can be subtle: a persisting cough at night, difficulty keeping up during play, or frequent chest infections. If your child has eczema, it is worth asking your doctor specifically about respiratory symptoms. The third condition is allergic rhinitis. This is what most people call hay fever. But in children, it's not always seasonal. It can be perennial, that is present all over the year, driven by dust mites, pet dander, or mold. It shows up as a persistently blocked or runny nose, frequent sneezing, itchy eyes, and a child who always seems to have a cold that never quite resolves. What parents often don't know is that untreated allergic rhinitis can worsen eczema and asthma significantly. These three conditions talk to each other. Now, what is the atopic march? The atopic march refers to the typical progression of these conditions in childhood. Eczema often appears first, sometimes in the first few months of life. Food allergies and gut-related symptoms may follow. Then, as the child grows, asthma and allergic rhinitis often develop, typically between the ages of 2 and 6. Not every child follows this pattern. Some have only one condition, some have all three, some develop them in a different order. But the pattern is common enough that when I see a child with significant eczema, I'm always thinking about the other two. And I'm always asking the parent, does your child snore or mouth breathe? Do they have a persistent cough? Do their eyes water often? Because these questions tell me whether the atopic tendency is expressing itself in more than one place. Why does this matter for treatment? Because treating eczema alone when asthma and allergic rhinitis are also present is only treating 1/3 of the problem. The inflammation in all three conditions shares a common root. Addressing that root requires looking at all three together. This might mean coordinating care between a dermatologist and a respiratory specialist, or a dermatologist and an allergy specialist. It might mean environmental changes at home, reducing dust mite exposure, managing pet dander, and reviewing diet. None of this is simple, but it is manageable when the full picture is understood. What I want you to take away from this is one thing. If your child has any one of these conditions, asthma, eczema, or allergic rhinitis, ask your doctor whether the others need to be evaluated. Don't wait for each condition to be treated separately by different doctors over different years. Ask for the full picture because your child's skin, their lungs, and their nose are all part of the same conversation. And the sooner that conversation happens, the better the outcomes. If you found this video useful, please like and subscribe and share it with the parent who may find this useful.